Hey, good morning and welcome to UroNurse News. You know the drill. Today, a major pharmaceutical company is under federal scrutiny. The U.S. Food and Drug Administration has issued a warning letter to Novo Nordisk, alleging the company failed to properly report serious adverse events, including deaths linked to its blockbuster weight loss drugs. These medicines include Ozempic and Wegovy, widely prescribed for type 2 diabetes and weight management, and currently used by millions of Americans. According to the FDA's March 5th warning letter, inspectors identified 5 separate cases involving patients who experienced stroke, suicidal thought, or death, including one death by suicide. The concern is not that these events occurred, but that they may not have been reported properly or even at all. The FDA states that these findings suggest, quote, systemic failures with surveillance, evaluation, and reporting, end quote. Now here's where things escalate. Following the FDA inspection, data analysis shows that in just 1 week, Novo Nordisk submitted nearly 11,000 adverse event reports related to semaglutide. More than 1,800 were classified as serious. Under federal law, serious adverse events, especially those involving death, must be reported to the FDA within 15 days. So what exactly did the FDA find? According to investigators, Novo Nordisk internal policies allowed staff to dismiss reports if patients or providers believe the drug was not responsible. But FDA regulations require reporting regardless of suspected cause. In one example, a patient who suffered a stroke while taking a related drug was not reported because they did not think the medication caused it. In another case, a woman who died taking semaglutide was reportedly never submitted to the FDA, even though his identifying details were found later in company records. The FDA also cited failures to follow up and improper dismissal of reports due to missing patient information. Novo Nordisk says it is working to address the issue and stands behind safety and effectiveness of its medication when used appropriately under medical supervision. And importantly, the FDA has not stated that these drugs caused the reported deaths or events. Instead, the issue centers on reporting compliance and whether critical safety data was communicated. Meanwhile, legal pressure is building. Thousands of patients, more than 5,000 cases, have filed lawsuits against drug manufacturers, including Novo Nordisk and Eli Lilly and Company. Allegations include failure to warn about serious risks such as vision problems, neurologic complications, intestinal blockages. Federal regulators have not yet announced penalties, but warning letters like this often signal early enforcement action. This marks the third FDA warning letter issued to Novo Nordisk in just 6 months, including previous concerns about manufacturing quality and misleading promotion. For healthcare professionals, this is a critical reminder of the importance of vigilant adverse event reporting, patient monitoring, and informed prescribing decisions. As the use of GLP-1 medications continue to rise, so does the need for transparency, accountability, and patient safety. I'm Vic Senese, and this is UroNurse News. Hey, tomorrow on UroNurse News, a major new health alert is raising concerns for women everywhere. What if menopause happening too early could significantly increase your risk of heart disease? New research suggests that risk may jump as much as 40%, and many patients don't even realize they're at risk. So don't miss it. Your patients and your heart depend on it.
UroNurse News every weekday at 9 a.m. Central Time.